right, everyone. I have that we're right on time here, so I'm going to go ahead and get started if everyone is ready. Dr. Jefferson? Yeah, okay. Well, I want to thank everybody for joining us and getting to answer some of your questions about Frontier Nursing University's DNP program. I am Dr. Kimberly Couch, and one of the clinical faculty and course coordinators at Frontier Nursing University. And we're going to go through just a real quick slides here of FN about Frontier Nursing University or FNU. And then we're going to give you plenty of time to ask some questions. So let's get started. Dr. Carr Jefferson, who is our program director, is here with us today as well. So you'll be able to ask questions of both of us. I am one of the course coordinators in the clinical portion of the program. I wanted to tell you, if you're not familiar with FNU, many of you may have already graduated from Frontier Nursing University, or you've heard about us, or you're interested in starting your terminal degree with Frontier Nursing University. But our mission is to provide high quality education that prepares nurses to become competent, entrepreneurial, ethical, and compassionate nurse midwives and nurse practitioners to work with all people, with an emphasis on rural and underserved communities. What we're going to cover today is why FNU, why would you choose us? Why get a Doctor of Nursing Practice degree? We want to talk about our programs of study, the admissions criteria, what a DNP project would look like, which is the final piece of the doctoral degree, how to get started, and some advising. FNU is built on a culture of caring. It is the culture of not only the way we treat our students, but the way in which our organization is designed. So everything we do from the ground up is literally all based on a very caring culture, the way we would want our patients treated and the way we would want to be treated here, which I think is a little bit different than most universities who are very top down. Your home community will become your classroom. We love the fact that you're in your communities, and that's where you will be practicing and performing your final quality improvement initiatives. This is not a brick and mortar school. This is about you designing a project and completing that in the community in which you live. You get to study from the comforts of home. You study at your time, anytime. We provide you with lots of virtual, lots of contact with your faculty so that you feel supported and that you have a nice cohort of students surrounding you as well to develop some relationships of support. The best part is you get to study when it's convenient for you. Every single one of you has very busy lives, and with family and jobs and your commitments, and this gives you the flexibility to work around when it's best for you. You will get to travel to beautiful Versailles, Kentucky for orientation. That's right outside of Lexington, and beautiful community, and we're excited to see you there. These are some pictures of our new campus. If some of you were at the old campus, which was in Hayden, Kentucky, this is a new and beautiful, although the other one was very special too, but this one is more collegiate feeling, very spread out, beautiful walking grounds and walking paths, the dorms, everything has been updated. Truly a new and beautiful college, university. We have 100 years of experience in nurse midwifery and family care. Students and alumni represent every state in the United States. We have over 10,000 graduates, and we have the premier and most experience in online education. When you look at other universities, we were designed around this focus and premise, and it's what we do really well. These are just some of the current FNU achievements. We have been received an Excellence in Diversity Award, the leader in DEI, and seven-time winner of Insight into Diversity Higher Education in Excellence. We've been recognized for 4 consecutive years and looking for 5 here as the great college to work for. We received the AACN 2023 Award for Inclusive Excellence, Belonging, and Sustainability in Nursing, and FNU was named Academic Honoree of the 2024 Healthy Work Environment presented by Sigma Theta Tau International Honor Society of Nursing. We are going to support you on many, many levels. Online support groups, student to student support. We want you to make those connections with each other. You will have faculty mentors. We have experts in financial aid. We have an amazing online library service. These people are dedicated to our doctoral students and helping you to make you as successful as you can, finding evidence-based practices to support you. There are student interest groups. There are committees that you can be a part of. We want you and we need your voice. Your support team is Dr. Cara Jefferson, who is the director of our DNP program. You have course coordinators like myself, course faculty who support the course coordinators and become continuity faculty in some cases for our students. We have academic advisors, financial aid officers, credentialing coordinators, and IT specialists, all of which who are dedicated to making you successful and having the best experience possible. So why get a DNP? Well, we are not research based. That would be a PhD. And I think that's where the delineation comes through. A DNP is based in clinical practice, but applying already evidence-based clinical knowledge and putting it into practice. It can take 17 years to implement new knowledge into clinical practice and new research. But what you're going to be doing as part of your DNP is applying already evidence-based best practices to solve a problem or a couple problems at your facility or in your practice to make for sure that we get you to the best standard of care possible. We're going to help you to develop an expertise and to lead and improve care in your organization. We want you to understand the process of quality improvement, and that's what we teach. The projects are incidental, and we do hundreds of different projects every year. But the process for the project is the same, and that's what we're going to teach you. It's real world implementation. You can take this back to your practices, this practice of improvement, quality improvement, back to your clinical practices, your hospitals, and you can apply it into your home settings even, and make sustainable and significant change. And most important, it's your terminal degree. So many people, that's the end point, is they just want the doctoral degree. Other people want teaching and education to be their ending point. They like that aspect of nursing, and the DNP is set you up for a beautiful academic career if that's what you desire. So some of the admissions criteria and the requirements of the DNP is that you must hold a master's degree in nursing or a master's in nursing, master's in science, or related field. You must have a current and active RN license in the United States with no encumbrances. You must be certified as a CNM or NP, had your last GPA would should have been about a 3.0 or greater, and that you on a background check will have nothing that would prevent you from being admitted into a nursing program. So our program of study lasts 18 months or 6 terms. It's 30 credits long. You begin your DNP project, the final project, not until the final term 3 or the final 4 classes. The the didactic work occurs first, and then it's followed by the clinical work after. The terms last 11 weeks with 2 weeks between the terms. Now, your didactic courses, and I won't read through all of these formalities and everything in numbers, but you will have nurses and educator, fundamentals of business and finance in advancing healthcare, population health, ethics and health policy, advanced evidence-based practice in nursing, and leadership and organizational dynamics. These are the leadership portions of the course. These are teaching you how to become a great and effective leader. Then it's going to be followed by the project courses. In DNP 850, it's called the project preparation course, and that's where we get your site all credentialed, and it's almost like going to HR and getting your all the ducks in a row so that you can start your project, making sure that we're all ready to go. The next course is scholarly project planning, and that's where you plan your intervention, your project, your quality improvement project. What we're going to have you do in that course is begin to look at your baseline evidence. What are the gaps in care, and what is the statistics and the data that you can find about your project and clinical sites about that project? What are the needs? What are the issues? We have you screen um, your charts, your patients, your staff, to make for sure that we get a whole 360-degree view of the issues that you're planning on addressing. In your scholarly project implementation, you will implement your project of improvement and then study the effects and analyze your data to see if you're making statistical change. You'll figure out some more problems, you'll think about some other ideas on how to fix them, and you'll apply those next. The actual implementation is only 8 weeks long, although the course is 11 weeks. Some of it is at beginning work on the front side of it and on the end side of it as you uh, formulate all of your data together. Then you end up in your DNP scholarly project dissemination, which is where you put all these pieces of the puzzle together, where you look at all the data that the evidence that you acquired in the beginning, and what kind of data improvement or what kind of quality improvements you made. And then you begin to write it up. So you will have 3 or 4 different assignments in that course. One is a quality improvement paper called Esquire, which could help you with publication if you decided to publish. Later, you would amend that to fit the needs of the publishers or the publication that you choose. You get a podium presentation that you will use to present your final doctoral project to the faculty of FNU. All of FNU are invited, your family, friends, your project site. We ask that your leadership, your team are all there at your presentation where you highlight all the success of your great work. You will end up with one of those big posters that you can present at a conference or in the hallways of your institution so that people can see the great work that you and your team did. And I think that's about it for that one. Uh, a lot of work, but a lot of fun. You come up with just amazing results, and we're excited to be a part of that here. Now, you do have some upcoming deadlines that you would want to start thinking about. September 24th is when the next application deadline is because coursework begins in the winter term, January 5. So you would like to begin to work on getting those in now so that we can get your applications processed. January 7th, of 2026 is the next deadline date, or not due date, not deadline. But the coursework for that would be our spring term, which is April 6th. And applications for that will open in the end of September. Now, there are some, you will have a DNP bound experience, so you will get to come to Frontier in Lexington, like we talked about. You will have 6 practice-oriented didactic courses. You will have DNP project quality initiatives over the final 3 terms. Your application steps include an online application. You will have a short essay in there about why, your whys for what are motivating you, and tell us a little bit about how you intend to apply your DNP in your practice or in your community. We will need your resume or your CV. You will have professional references that will be needed. And of course, we grab your transcripts from wherever you graduated from with your nursing and your master's degrees. Tuition currently is as $705 a credit hour, which is one of the least expensive programs out there. So we're happy to say we are very competitive with our prices. So how to enter the DNP is once you've completed that admissions application, it goes to a board that looks at all of our applications and makes for sure that all of the requirements and that uh, are there, and then your application is reviewed by faculty to see what a good fit you're going to be, and then this it goes back to the nursing university who then make the offers for the waiting places or the spaces in our program. We took external applicants who are NPs or CNMs, returning FNU, MSNs, and postgraduate grads. All right. Does anyone have any admissions questions right now? I can't see the chat box, Cara, so.
In the chat, we just posted links so far, but I don't see that there are any questions.
All right, well, I'll move on.
And remember, guys, if you have questions, you can either put them in the chat or you can just unmute your microphone and ask us.
And we'll have time for question and answers here too in a few minutes.
We have a question. What
Oh,
about
good.
financial aid for international students? So at the end of this presentation, there will be a slide that shows you how to contact financial aid because we don't deal with the financial aid part of it. Me being the program director and Dr. Couch is a course coordinator. So you would actually reach out to financial aid to get the answer to those questions, especially regarding international students. We also have someone from the Eddie team here. So, would you be able to put to talk about the application fee?
Hi, good afternoon, everyone. My name is Martha, and I'm an enrollment coach on behalf of Frontier Nursing University. There is an application fee. It is $50. It is non-refundable and non-transferable.
Thank you.
You're welcome.
And thank you for putting that link to financial aid in the chat.
Now, can you guys still see the pre-planning the slide?
Yes.
Okay, beautiful. So we want to talk a little bit about the expectations, topic ideas, programs of study, and such. And Cara, those are coming up on slides, right?
Yes.
Okay. So if I'd asked people what they wanted, they would have said faster horses from Henry Ford. And although we all know he gave his cars much faster horsepower in the DNP program, it is not about task oriented, check off the task. It is about immersing yourself in the project idea and the evidence surrounding your project and really learning. We want you to learn the quality. So we don't need this to be fast. We need it to be thorough. And so it's a different viewpoint than when you were in your nursing program where you had to memorize drugs and facts and drip rates and all of these different things, medications and half-lives. This is very different. Because you all have unique situations where you work, unique practices, and it's learning about how to apply the principles to what you need. And so, little different learning environment. So, do you have a potential clinical site? So, the question is, are you working? We would rather you implement at your workplace during your job work, if possible. So, we don't need you to take on an additional clinical role. You implement as an RN or in your APRN role. You can volunteer in an additional site, but it's challenging because that means you're adding work days. You're already working a full-time job and adding a volunteer job. Our program wants you to implement in the practice where you're working on the patients that you're seeing that day. So, when will I be starting a new job as advanced practice nurse? So, this is usually a question for our brand new APRNs who are thinking about going straight from an APRN um, and they're barely started working right into their doctoral program. We want you to get used to your APRN practice. It's challenging enough to get into that role with all the things that have, everything that goes into being a new employee somewhere, not and then seeing patients in your new role. So we ask that you consider, is this the best time? Should I wait a term before I apply to get settled into my new job? We don't want you to start planning a project at the same time as you start a new job because you're going to be implementing change. And change is very hard to do when you're the new kid on the block. Nobody likes change to begin with. And then to be the new person coming in saying, okay, now we're all going to do this differently is difficult. It can be done, but it still adds a whole nother layer of drama that you probably don't want or need. The other thing to consider before you apply is, do I anticipate any major life events? Are you going to be moving to a new practice or a new area? Are you thinking about growing your family? Do you have some significant health challenges in your family, like taking care of elderly parents or anything that is going to cause you an added layer of stress? Believe me, the doctoral program is rigorous and it requires a tremendous amount of time. So we want to be upfront and to say it's doctoral level work. And so if you can time getting into your program when you might not have issues like growing your family or making a move to another area, that might be beneficial to you. And what does your schedule look like? Are you overwhelmed already with your work schedule, life, work, responsibilities? Because this won't make it any better. It's going to make it more challenging. You all are adults and we leave that up to you, but we want you to think about these kinds of things as you plan the timing into applying in for FNU. We want you to come and we will support you no matter what your needs are, but we want you just to be very mindful of the fact that it's a very rigorous program. All right. And Dr. Jefferson is going to highlight and spotlight a story about Stephanie Mitchell for us.
So Stephanie Mitchell was one of our DNP students. I believe Stephanie also came to Frontier and got her midwifery degree. And so the reason that we're proud of Stephanie is because when she came into our program, it was never imagined that she would want to create or own her own birth center, but it was through all of the things that she learned throughout the program, not just about quality improvement and um, health policy, but also being a leader. And in our entrepreneurship course, she decided that she was going to open a home birth practice in a state. So this is what we hope that our DNP students embody, some of this, where you're taking not just the skills that we teach you in real time, in real life, and apply them to the real setting. But we also want you to imagine the possibilities of what could be for you, because for each of you, that looks a little bit different. And our goal is just to help get you there so that you can take your nursing career or your advanced practice nursing career to the next level. So the distance between who I am and who I want to be is separated only by my actions and words. The reason that this is here is because there are a lot of people who say, well, I think I want to go back to school. Well, I think I want to get my DNP degree. And the reality is there's actually nothing stopping you. You can talk about it all day long, but until you implement the first few steps, you're not going to be able to actually get that DNP degree. So we don't just want you to talk about getting your DNP. We actually want you to take action, submit the application, speak to whoever you need to, whether that's family, friends, or that's somebody on Frontier's side, so that you get the information you need. But we just want you to actually take action. And here's what we do know. There will be obstacles. Of course, this is a terminal degree program, right? There will be doubters. There will be lots of people out there who say, why do you even want to get your DNP? Your pay may not change. Nothing in your life may not change. But maybe it's actually not about any of those people. Maybe it's about you and your aspirations and your dreams. Or maybe this is a dream that somebody in your family has had for you. Or maybe everybody else in your family has a terminal degree except for you, and this is the reason. Whatever your why is, it's your why. But know that there will be doubters. It is inevitable that we will all make mistakes because we are all human and none of us are perfect. But we do know that with hard work, there are no limits, and you will be able to accomplish your dream of obtaining your doctoral degree. So success doesn't come to you, you go to it. I think that sums up this whole thing. That's why we do this. We do this because we love what we do. We enjoy teaching leadership, health policy, entrepreneurship, quality improvement, quality assurance skills. But what success looks like for you is completely dependent upon you. So there was a question in the chats asking specifically about what is the acceptance rate of all applicants that fulfilled the admission requirements. So one of the things that we don't have, or I don't have, because I am actually not on the admissions committee on purpose. We have a completely separate admissions committee that reviews files for applicants. And so I don't look at that specific data. We're actually forming a committee right now so that all of the program leads will have more insight into that data, but as of right now, I cannot give you any specific numbers because that comes from a completely different department, and anything that I say would just be a guess, and I don't like to guess. What if there's a miscommunication in the required document for administration and the deadline to submit each document was not met due to miscommunication from the admissions team? Can the fee or application be transferred to the next term because proper information was not given? I think the representative stated that the application fee is $50 regardless of if your application is complete or if your application is incomplete. But we know that with our application deadlines, there's a huge window of time to get your documents in. So if you have specific questions about a specific document, I would encourage you to reach out to the admissions team and they can help you to figure out where the potential miscommunication occurred. Sometimes things get lost in translation in email, and sometimes a phone call is actually a better means to communicate because sometimes we're talking about apples and zucchini from both ends instead of apples to apples. So there is not a direct admit for current students. That process actually went away in 2020. It was either the end of 2023 or beginning of 2024 where that was actually communicated even before that in 2022. So current students cannot be directly admitted into the DNP any longer. That was called our companion DNP program. Our current students must actually pass boards and have their APRN degree conferred before they can enter into the DNP program.
Anyone else have questions for us? How large are
I have
cohorts?
I have a quick question, kind of in line with what the last question was. So I see that the application deadline for this year is September 24th. If I'm a current student and I'm anticipating graduating next year, and it depends on, the completion of my clinical hours, it's possible that I could be complete and have my boards done by September, but boy, that's a pretty close deadline. Um, I'm just kind of curious if you've had other students in the same situation where I'm looking to go right from my master's into my doctoral program. And if you can speak to like maybe how I might best plan that next year in order to be able to make that application deadline.
So in this case, so normally for application deadlines, I always encourage everyone you want to apply as early as possible. We do have rolling admissions currently, so the earlier you get everything in, the better. But I understand that in your case, and the case of probably several other students, it's not possible. So in that case, the one thing that I would probably make sure is that you would not submit your application until you are positive that you have taken your boards and have passed. So as long as it's before, we take applications up until the last day and we consider them just as seriously as we consider somebody who submitted their application on the very first day. So you're not missing out. Don't feel like you're missing out on anything because you're applying at the very last day as opposed to somebody who applied on the first day. I just want you to be thoughtful about your timing of when you apply to make sure that you have all of those requirements because I know that financially, while $50 may not seem like a lot of money to everybody, it can be a lot of money to some people. So I don't want you to spend $50 and have an incomplete application and then 2 weeks later turn around and have a fully completed application. Does that help, Jody?
Yes, thank you. Just so that I'm clear though, There is only one cohort for the DMP.
Yes, there's only one
Right.
cohort for the DNP.
And traditionally, those are all starting winter term, correct?
No, so we admit students into our DNP every single term, just like our MSN program. So you could start in the winter, the spring, the fall, the summer, all
Oh,
of
great.
those
Okay,
things. So
that
even
helps.
if,
Thank you.
yes, so here's the other thing that I think I would tell you. After you pass boards, there is a time that people are generally looking for jobs. And the one thing that we know is that our more successful students have carefully gone and onboarded to a new job or searched for a job, got into that site, and have successfully onboarded before they get into the DNP, because feedback from our students when we did have the companion program fully active was like, oh my gosh, like I'm trying to do all of this coursework and I'm trying to onboard and I'm trying to do this it's too much, right? So I will always tell you and come from a place of work-life balance and wellness, that your overall health and wellness, I don't want your sympathetic nervous system to be so stressed out that you can't get anything done. I actually want you to be living optimally and functioning optimally while you're in the program. So actually having a small break if you finish, let's say you take your boards at the end of September, it gives you time to find a job, get oriented into that job, and then start your coursework. A little bit of a break is always healthy.
I'd like to answer a few questions that are in the thing. So I want to make sure we understand that we're talking cohorts. So there are some questions about working in groups and things like that. Initially, you're admitted into a big cohort to go through the the didactic piece of that. Once you get to the clinical portion, you are assigned a continuity faculty person. And that's one of nine of us, I think we have now, nine faculty. And those nine faculty will we divide up those students. We try to get it into time zones so that we're all talking at this, convenient times for you. But not, it doesn't necessarily pan out that way, but we try. So what happens then is each faculty member will have between 4 and 8 students in their cohort. And then you move together through the clinical portions. But the actual work on the project is not done as a cohort. It is just you're supporting one another. Okay. The work on the project is done individually at your site. So you will gather evidence about a problem that you think you have, and then you will plan a project around your site, your nuances in your clinic and your institution. You can't do a group work project on that because you're all working in different places. Do you have to have your idea before you start your DNP? No. No, no, we'll help you to explore that by having you speaking to your quality improvement department, your leadership, and that occurs much later in the program. We want you to get established. You'll figure it out. You'll know something pops right to the surface that says, you know what, we're supposed to be doing domestic violence screening on every patient, and we don't. Perfect project. Let's start screening. There are many examples of that. Like, we don't do a great job with diabetic foot exams. We just don't do them as routinely as we should. And maybe that's something I could do a project on. It doesn't have to be a save the world idea. It just has to look at one quality improvement around one idea. Does that help?
I think you answered that well, and that encompassed several
Right.
several of the questions here. Another question was, are there certain states that are off limit for clinical sites, such as with the MSN program? That's a great question, Arthur. Currently, our DNP program does not have any restrictions on sites because the majority of our DNP students are actually conducting their DNP clinicals or their DNP project in the site in which they are employed. So that generally keeps us out of the line of fire for some of those other sites. The one site that could potentially be an issue if it were a volunteer site would be New York, but all other states, and I meant states, not sites, all other states are pretty much open right now. The other question is, would I be able to get credit for a course I took in the FNP program, Ethics and Health Policy? So our current policies in our catalog, we have a policy which is the evaluation of previous academic work. And it says that transferred courses must meet comparable course objectives, essentials, and competencies as are included in the FNU course. For example, if a course is transferred into the DNP, the course must contain doctoral level content and must contain course objectives that are comparable to those of FNU's DNP course. So, variables that influence course transfer include the age of the course and the student's certification and the clinical practice experience. To be considered for transfer, DNP courses, one, must be part of a previously completed graduate degree, or two, be less than or equal to 5 years old at the time of admissions. DNP level courses that were not part of a previously completed graduate degree and are older than 5 years may be considered on a case by case basis as determined by the DNP program director, which is me. So that is our policy. Are there any other questions? So I do not meet, so I can send you, if you email me, I hate to mispronounce names, but if you email me, Miss Solis, about the course transfer, I can send you our actual policy in writing. What happens is I cannot meet with you to discuss it specifically because I am part of the actual review committee and it's a conflict of interest for me to advise you on it. So, what our students do is fully read the full catalog and the policies. You can even reach out to the registrar's office and they can even give you that information. But I would not be able to tell you, yes, your course looks good enough for transfer, or no, it doesn't. Lola asks, as a private practice owner, can I complete my project while working in my practice? Yes, with conditions. So, as a private practice owner, you can use your actual site for your DNP project, but there still has to be some other level of oversight so that we make sure that you are getting things done. But it is possible. We have had several students do this without any problems. Thank you for dropping that course transfer policy in the chat. And did I miss anything?
Kyle wants to know about DEI at Frontier.
So Frontier has had several DEI initiatives in the past. We have also received awards for our work on diversity, equity, and inclusion. So Frontier has been in the forefront. We also recognize that with the governmental changes in policies, there are words that are banned, but our courses and our essentials still have elements of DEI interspersed in them because those are actual national standards. So, of course, we still have all of that there. As far as other things that we offer, I think Dr. Couch talked about this. There are student interest groups. And so diversity means a whole bunch of different things to a whole bunch of different people. And so there are the different student interest groups that students can join. We have a whole bunch of resources for students related to all of those things. So, as far as the course transfer, you wouldn't submit for course transfer until after you have been admitted into the program. You wouldn't do it in advance. You would wait until you get admitted into the program. You've had a chance to look at like what the course descriptions are before you would actually submit that request to the registrar. Oh, perfect. So yes, if you have been admitted, you can submit that request to the registrar. Congratulations. Anything else?
Can you apply for financial aid prior to being accepted?
So you can always complete a FAFSA. I do know this. You can always complete the federal application for or whatever the thing is called, but it's the FAFSA. I can't think of all the acronyms right now. But you can complete your FAFSA before you are admitted into any program. And then if you are awarded funds, then you would just have to go back and specify which program. And I would encourage you, Charlotte, to reach out to our financial aid office because they are a wealth of information and know everything regarding all of the financial aid policies and probably could advise you on the best time to do each of those things. So I don't see
Questions, no?
any other questions. And so, in the interest of your time, you've spent already 45 minutes with Dr. Couch and I. And so please reach out if you have any questions. There are lots of links that are here in the chat. This is recorded, so it will be posted at a later date. So if you miss some of it and you need to go back and re-listen, it will be there for you to do.
I'm looking forward to meeting each of you at Frontier Bound. See you soon.